Good morning, good afternoon, and good evening. Thank you, everyone who's joined us. We are seeing people come online from all over the world. As people come online, we'll start in just a moment. Um, we are going to be translating the service. So if you are here, you're in the right place. We're introducing the new Safe Abortion Calculator from Guttmacher, a new tool for safe abortion advocacy. Um, if we can advance to the next slide, you will see instructions for translation for this. We are using Wordly AI, um, is a tool where we can translate into more than 60 languages. To view the transcript with Zoom, please use the link shared in the Zoom chat. We'll periodically share this link again as more people join so they can continue to use this. As more people come, they'll continue to be able to join. To follow along on a separate device on your headphones, for example, please scan the QR code on the screen. It has options to both read and to listen, whether on the Zoom or on your own separate device. Please note that audio interpretation is only available through your separate device using the QR code. I think we have a good quorum to begin. So with that, I'm going to hand over to the co-CEO of the Guttmacher Institute, Destiny Lopez, to begin our session. Destiny, over to you. Thank you so much.
Thanks, Kirsten. Hello, and again, good morning, good afternoon, or good evening, depending on where you are joining us from. Thanks for being with us. My name is Destiny Lopez. I'm the co-president and CEO of the Guttmacher Institute. It's really an honor to be with you today. Thank you for your time and to welcome you to our launch for an exciting new tool developed by the Guttmacher Institute, the Safe Abortion Calculator. I'd like to open by grounding us in a truth spoken many years ago by the late Dr. Mahmoud Fathallah, who was former president of the International Federation of Gynecology and Obstetrics, who was also an architect of the ICPD Program of Action and a lifelong advocate for reproductive health and rights. He said, "Women are not dying because of diseases we cannot treat. They are dying because societies have yet to decide their lives are worth saving." This truth stands firmly today as it did 40 years ago. Injuries and deaths from unsafe abortion or other pregnancy related causes are a crisis that stems from social and political inaction, not from a lack of medical knowledge. This is the why for our gathering today. Feminist movements have fought tirelessly for decades to prove that safe abortion care is fundamental to bodily autonomy and sexual and reproductive health and rights. We have seen enormous advances in legal and policy frameworks governing safe abortion care thanks to their bold vision and leadership and dismantling the legacy of colonialist laws. Yet, as we gather here today, we must also confront the reality that access to safe abortion care remains deeply inequitable, even in countries with expansive laws, and there is much work to be done to change the reality that women are dying preventable deaths. In 2024, 206 million people in low and middle income countries became pregnant. And of the 58 million pregnancies that ended in abortion that year, more than half were unsafe, not because of medical impossibility, but because of the political and societal barriers that make safe abortion access inequitable and put their lives at risk. Unsafe abortion places enormous burden on individuals, families, and health systems. The human cost can be devastating, and the economic cost staggering. But most importantly, this is all entirely preventable. As people in this Zoom space know all too well, abortion can and should be a safe procedure. It doesn't require high-level surgical centers, but can be provided safely at the community level at healthcare centers or through self-managed care at home. Unsafe abortion, however, can place a burden on strained health systems. The Safe Abortion Calculator proves that by shifting resources from the high-cost emergency surgical treatment of complications, such as sepsis or hemorrhage, to the less costly provision of safe abortion care and contraception, health systems can protect bodily autonomy while saving lives and money. We cannot deny that today we are in a moment of shrinking health budgets, intense pressure for domestic resource mobilization, and escalating attacks on reproductive rights. To succeed in protecting and expanding safe abortion care in this environment, we need to be able to speak multiple languages. We must speak the language of human rights, gender equity, and healthcare, but we must also be prepared to speak the language of finance ministries and budget decision makers. The economic argument made through the safe abortion calculator equips the rights argument, and the evidence is unambiguous. Providing quality abortion care is considerably less costly than treating the complications of unsafe abortion. We are incredibly proud to introduce the Safe Abortion Calculator with our global partners. This tool was developed by experts at the Guttmacher Institute, some of whom you'll meet today, built on a rigorous adding it up research framework. It was designed specifically to strengthen the hands of those already doing the work: advocates, civil society organizations, feminist organizations, and the allied policymakers. We are confident that this research-backed tool will transform conversations and move us to concrete, evidence-based demands for change. I'd like to take a moment to recognize the donors who have made this work possible, supporting not only the development of the calculator, but who have made important commitments to advancing reproductive health and rights and gender equity by supporting advocacy movements. We thank the Government of Canada, not only for support of the calculator, but for joining us as a co-sponsor of today's webinar. We are so pleased that Karoline Kemp, Senior Health and SRHR Specialist with Global Affairs Canada, is able to join us today. We would also like to thank the Children's Investment Fund Foundation. Now, I'm really thrilled to introduce two of my incredible colleagues and also let you know that one of our colleagues and a real leader and champion of this work, Dr. Elizabeth Sully, who's our Director for International Research, and we had hoped to have join us today, is offline, feeling a little bit under the weather, so she's not able to speak, but she is here and in the chat and will be able to answer questions and weigh in as needed. But in her place, I'm really thrilled to introduce my colleagues, Margaret, Giorgio, and Jessica Rosenberg. Following their presentation, we will have a conversation with a panel of phenomenal leaders in abortion advocacy to discuss how this moment is calling us and challenging us to build stronger and broader movements. So thank you again for being here today. Let's get to the work of the morning, evening, and afternoon. I believe, Margaret, the floor is yours. Thank you.
Thank you so much, Destiny, and hello, everyone. Thank you for being here. I am delighted and excited to introduce you to a new tool that builds specific, clear, evidence-based economic cases for safe abortion care. Over the next few minutes, we will walk you through three things: what the safe abortion calculator is, the data behind it, and how it can be used to support abortion advocacy. Next slide, please. The Safe Abortion Calculator is a free, interactive online tool. Advocates, policymakers, and researchers can use it to estimate and visualize what expanding safe abortion access would look like in a specific region or country. The calculator is powered by data from Adding It Up, which is a flagship research project at the Guttmacher Institute that has been modeling the need for, impact of, and cost of sexual and reproductive health services for over 2 decades. Adding It Up has long been a critical resource for documenting the need for care, the health benefits of meeting these needs, and the financing gap for sexual and reproductive health. So our new Safe Abortion Calculator takes that body of evidence, builds on our abortion impact and modeling work, and puts it at your fingertips. One small note that the calculator generates estimate for a subset of the countries that are included in the Adding It Up 2024 analysis. Specifically, we only include low and middle income countries in subregions where unsafe abortion is a persistent problem, which we define as those with an estimated incidence of unsafe abortion over 25%. So what that means is that this analysis includes 117 countries across Africa, Asia, Latin America and the Caribbean, and Oceania. Next slide, please. So let me start with the scale of the problem of unsafe abortion in these contexts. In 2024, an estimated 48 million induced abortions took place in these 117 low and middle income countries that we include in the calculator. Among those, overall, 2/3 of those abortions were unsafe. That is 32 million unsafe abortions in a single year. When abortions are not provided safely, the risk of serious complications rises dramatically. These complications can include hemorrhage, infection, long-term pain, and infertility. We estimate that 21,000 people died as a result of such complications in 2024. Next slide, please. I also want to take a minute and be very specific about what we mean by a safe abortion. So a safe abortion is one provided by a trained provider using an appropriate method for the pregnancy duration. And I want to flag an important caveat on self-managed abortion. Abortions can be self-managed safely outside a health facility when people have access to accurate information, quality medicines, and support from a trained health worker if wanted or needed. The 2022 WHO abortion care guidelines are very clear about this. However, we do not yet have sufficient data to quantify self-managed abortions at the population level, including how many people who do self-manage an abortion have access to this kind of accurate information, quality medicines, and support. And so because of that, most self-managed abortions are not included as safe in the estimates that the calculator currently produces. That is a limitation, but we are actively working to address this for future versions and iterations of the calculator. Efforts to expand access to safe abortion care will and should include, as part of that, women's ability to safely manage their abortions if they so want. In the calculator, we estimate safe abortion care provided with support from the healthcare system. However, the WHO guidelines are very clear that safe abortion care includes self-managed abortions. So now I'm going to turn the presentation over to my colleague Jess to talk about the model itself and what we find in our analyses. Thanks, Jess.
Yeah, thank you so much. So before I show you the calculator itself, I want to briefly walk through how we produce the estimates that go into the calculator. The core question our model addresses is this: if all abortions currently happening in low and middle income countries were provided safely through the formal health system, what would that mean for healthcare outcomes and for costs? And to answer that, the adding it up model draws on 4 categories of evidence. First, abortion incidence and safety. We use the WHO classification system, which categorizes abortions as safe, less safe, or least safe based on whether or not they use a WHO recommended method and whether or not they are performed by a trained provider. Second, methods of service provision. What abortion methods are being used and at what gestational ages? For this, we don't have great country-level data, so estimates are produced by sub-regional or country groupings based on the abortion provision in those contexts. Third, complication rates. So this is where the difference between safe and unsafe abortion becomes stark. Safe abortions have very low complication rates, which we estimate to be around 3%. And based on the latest research on unsafe abortion, we estimate that 40% of unsafe abortions result in complications. This is actually a very big change from some prior estimates that we've produced. And as more people have had access to medication abortion, we are seeing complication rates reducing. Overall, the enormous gap in the rate of complications is what is driving the health impact of expanding safe abortion care. And fourth, we estimate the cost of each abortion intervention, including abortion by method and post-abortion care by type of complication. And together, these 4 inputs allow the model to estimate what happens when you shift abortions from being safe to becoming safe. From unsafe to becoming safe. Next slide, please. Post-abortion care complications are not only devastating for women and their families, they're also extremely costly to health systems. We estimate that in 2024, providing post-abortion care to everyone who needed it across these 117 countries would cost over $1.5 billion US. The largest burden falls on Asia at nearly $838 million, followed by Africa at about $480 million, Latin America and the Caribbean at over $242 million, and Oceania at about $3 million. And these are real costs that health systems are bearing right now, and the vast majority of them are the direct consequence of unsafe abortion. Next slide. So how can countries reduce these costs? By ensuring that people have access to safe abortion services. We estimate that if all abortions were provided safely, the number of people needing post-abortion care would drop from about 13.4 million to only 1.4 million. That's an 89% reduction. Think about what that means for health workers, for hospital beds, and for the women and their families. Next slide, please. So I'm going to briefly walk you through the investment case here. So on the left, you see the current picture. Countries are spending about $334 million a year on safe abortion services and more than $1.5 billion on post-abortion care, meaning that the total cost for health systems is about $1.9 billion. And on the right, you see what happens when all abortions are provided safely. Yes, we do see that spending on safe abortion care services increases to about $1 billion, but we see that post-abortion care costs collapse from about $1.5 billion to just $169 million. So the net result is a savings of $728 million each year. Thank you. And this is not a hypothetical long-term economic benefit. This is an immediate reduction in costs borne by the healthcare system. Providing safe abortion care is not only the right thing to do, it is the fiscally responsible thing to do. Next slide, please. And now I'll hand it back to Maggie, who will be walking us through a short demonstration of how to use the Safe Abortion Calculator in action.
Okay, thank you, Jess. I will share my screen now. This is when things go live and get very exciting. So, okay, here we go. So I'm going to give you a demonstration of how the tool works so that you can generate these estimates for yourself, for your country, and in your own currency. This Safe Abortion Calculator is currently live on the Guttmacher website, and when you navigate to the page, this is what you would see, or what you can see. And so before I start showing you how to use the calculator, I just want to orient you to what is on this page. This toolbar here at the bottom that you see is how you control everything. And there are three main things that you can modify. This slider down here allows you to change the proportions of abortions that are being provided through safe abortion care. Every time that you navigate to the page, it's going to default to what the current estimate is. So as I said before, 32% of abortions in our 117 countries were provided through safe abortion care. This box down here allows you to select the country or region. And here you can select the currency that you want your results to be displayed in. And down here, you can change what language is the results are being shown in. And then when you scroll down, here we have our charts. So this first one shows you the change in abortion care costs from current estimates. Right now, these two charts look identical because we haven't moved anything yet. Nothing has changed. And then this second chart down here will show you changes in the number of people who need abortion care. And again, we haven't changed anything yet, so nothing has changed. Okay, so now for the fun part. Let's say that I want to know what would happen if the proportion of safe abortions in our 117 countries doubled. So it went from 32% to 64%. So we take our slider and we move this up here to 64%. And what you see is that the charts are updated instantly. And we also see here that when we increase the safety rate, safe abortion care spending rises, as shown in the orange, but post-abortion care costs drop dramatically, shown in violet. In this example, doubling the proportion of safe abortions would result in a 17.8% reduction, and that's what we see here, in total costs, which corresponds to over $300 million in global savings. And you'll also see down here, we have this anchor at 32%, which is the current estimate of the safety rate. So the user can always easily remember what we're comparing the new estimates to and how to get back to what the current estimate is. And then here also we see the change in the number of people needing post-abortion care. So the next thing I want to show you is this green button down here. It says, show data if all abortions occur in the healthcare system. So basically, if you click this button, it automatically makes the safety rate 100%. And there it is. It's the same chart that Jess just showed you, generated in real time. And again, scrolling down, we see the estimated change in the number of people needing post-abortion care. And as Jess said, in this scenario where all abortions are provided through the healthcare system, it drops by almost 90%. But the real power of this tool is that it's not limited to one scenario. Let me walk you through some examples, starting with budget cuts. So going back to the top, and you can also change the rate here in this box if you don't want to use the slider. So here we are, we're back to our original estimate at 32%. Say you're in a meeting with a finance ministry that is considering cutting safe abortion services. Instead of arguing in the abstract, you can actually model that cut. So here, if I put the slider from 32% down to 20%, watch what happens. The violet bar increases, post-abortion care costs have increased, and the calculator tells you exactly how much spending goes up right over here. And you can see it turned from green to red. So the cut does not save money. It shifts the spending of treating complications to treating complications and at a higher price and at a devastating human cost. And again, here is that human cost. This would result in more than 2 million more people needing emergency post-abortion care under this scenario. Okay, and then one more example. Here we are back to our original estimates. I've only been showing you global estimates, but one of the most powerful features is that you can use it to create country-specific estimates. So imagine that you're an advocate in Kenya building the case for including safe abortion care in the National Health Benefit Package. What I can do is I can select Kenya, and every estimate on the screen will now change to be Kenya-specific. Here we go. And you see here the current safety rate in Kenya is 24%, which is lower than the average for all of our countries. And you can do this for any of the 117 countries that are included in the model and also for sub-regions. And here is also what makes a really big difference. I can switch the currency to Kenyan shillings. So I click here and I start typing in Kenyan shillings, and here we have it. And now all of the estimates will no longer be in US dollars, and people don't have to try and do the work of translating US dollars into Kenyan shillings. And again, I don't have to model what would happen in the perfect world. If a realistic policy target is moving the current level from 24% to 50%, I just set the bar here and I move up to 50%. And I get the savings and the post-abortion care cases averted for that case, which may be a more achievable scenario for that country-specific context. This is often a more credible number to put in front of a policymaker as opposed to 100%. The other really neat thing about this calculator is that you can take the results with you. So once you've built this scenario, you can generate all of this evidence and it can leave the website with you. You can download each chart here. You see down in this navy box where you can get right here, you can get the images so you can put them directly into a slide deck. You can also get the data inputs here. And also you can just click this link here to get a link to these very specific results about, in this case, it would be in Kenya moving from the current estimate to 50%. And that part is really nice because you can send that URL to colleagues or journalists or anyone else that you think would like to be able to see these results. And down here again, I had noted this before, but you can change the language to English, French, or Spanish. And then the last thing I want to say is down at the bottom here, we have, if you want more information into how we have built the calculator, all the data inputs that go into it, we have a Q&A, or a frequently asked questions page and more information here. But really the best way to learn about the calculator and how to use it is to open it and start moving the slider and changing the country estimates and seeing what works. The last thing that I want to point out to you is this purple box here. This here is a place where you can share your feedback. We really genuinely would love to hear from you how you use it, what is helpful and useful, and also what we could do to make it better. And so please, if you are using it, we'd really love to hear your feedback. Okay, so that's it. That's the tour. And I'm going to hand it back to you, Jess.
Thank you. Okay, so this brings us to a framing that we think is really important. The case for safe abortion care rests on two mutually reinforcing pillars, the rights case and the economic case. The rights case is one that feminist movements have been making for decades, and it remains as important as ever. Abortion is one of the most common health interventions worldwide. When provided using WHO recommended methods, it is extremely safe. Safe abortion care is a core element of the Guttmacher Lancet Commission's essential package of sexual and reproductive health services, a package that improves health, saves lives, and expands opportunities for women and girls. The economic case does not replace that argument. It reinforces it. Safe abortion services could save health systems $728 million every year and reduce the number of patients needing post-abortion care by 89%. In a moment when health budgets are under extreme pressure, these are the kinds of numbers that get the attention of finance ministries and budget decision makers. We developed the Safe Abortion Calculator to help build the second pillar, to give advocates a tool that speaks to those audiences without ever letting go of the first. Next slide, thank you. So the Safe Abortion Calculator joins Guttmacher's Family Planning Investment Impact Calculator, which estimates the health and financial returns to investing in family planning. Together, these two tools give advocates country-specific economic evidence to complement the rights-based case for comprehensive sexual and reproductive health services. Both are free, open access, and designed for the advocates and policymakers doing this critical work of ensuring bodily autonomy and sexual and reproductive health and rights. And now Maggie will provide us with some more information about use cases for the Safe Abortion Calculator.
Thank you so much, Jess. And actually, I'm not going to spend a ton of time on this slide. I think we went over some of these scenarios before, and I want to really make sure that the panelists have enough time to answer questions. So I just want to highlight that there are many different use cases here, and we're really excited to start to get to see this, this tool in action. Next slide, please. Again, I want to echo Destiny's gratitude to our funders and our donors for this work. And we really hope that this tool is going to be useful to you. We built it for exactly for the people in this room and the movement that you represent. So I really look forward to hearing from our panelists about how this kind of evidence fits into the broader advocacy landscape and hearing your feedback. Thank you.
Thanks so much, Jess and Maggie, as well as Beth, and frankly, a whole team of researchers and communications experts that have supported the development of the tool here at Guttmacher, and insight from many donors and partners as well. I am thrilled to welcome our panelists for this part of the discussion. Again, if you have questions about the tool itself, please feel free to jot them down or throw them in the chat. We'll have Q&A later. I'm going to introduce each of our panelists in turn, and then we'll hear from them individually, and then we'll get to the Q&A. So we have a panel of really remarkable and experienced sexual and reproductive health rights advocates. I'm grateful for their time. Dr. Jessica Oga is the head of the Ubingwa Think Tank at Afya Haki, a leading African institute that generates knowledge and builds advocacy capacities in health, human rights, and sexual and reproductive health. Sivananthi Thanenthiran is the executive director of ARROW, the Asian Pacific Resource and Research Center for Women, which is a regional feminist organization working on sexual and reproductive health and rights and gender equality across 16 priority countries. Diana Moreno Pabon is the executive director of Ipas Latin America and the Caribbean, working to advance reproductive justice in the region by expanding access to abortion and contraception. And Karoline Kemp is Senior Health and Sexual and Reproductive Health Rights Specialist with Global Affairs Canada, the Canadian Development Agency, which made sexual and reproductive health and rights a centerpiece of their feminist international assistance policy. Welcome to our panelists. Today, we are looking across borders to understand how movement leaders are navigating complex political and legal landscapes in different parts of the world. And we're talking about the tangible tools and levers being used to secure and protect reproductive freedom. We'll start with our first round of insights from the three regions represented here. So panelists, each of your organizations has had to make strategic bets about how to make the case for safe abortion in your context, whether that's through legal reform, health systems integration, grassroots mobilization, or economic argumentation. I'm going to ask each of you in turn to walk us through a specific moment where you had to choose your strategy and what made that choice work or not work. And I'm going to start us off with Diana. Diana, the accompaniment collectives across Latin America built an extraordinary infrastructure for safe abortion access outside formal health systems. So now that legal reform has advanced in several of those countries, tell us more about the relationship between those grassroots networks and the public health system. Is integration the goal, or is there value in maintaining an independent feminist infrastructure alongside state services? Diana, welcome.
Thank you, Destiny, and thank you to the Guttmacher team again for creating, I'll say once again, a tool that allowed us to advocate for the right and access to abortion. Through my time as an advocate, Guttmacher's tools have been key for discussions in Latin America and how we push to have greater access to sexual and reproductive health. And I think that the Safe Abortion Calculator is one of them that allows us to think about not only the rights perspective, but an economic perspective that can be also communicated in many ways. Behind an economic cost is also a human cost. And a good part of this is that we are able to understand how the cost is being distributed and be able to talk to different actors. Many times we believe this information is mostly around the big decision makers. So I'm going to say legislators, the main executive branch, maybe high stances in court, but to be honest, through time, I have also learned that being able to advocate before the health system itself and health authorities and even just health providers that are actually facing part of this cost makes a huge change. So I believe this tool allows us to bring these arguments to both spaces and be able to push for that. So just on your question, I want to say acompañantes in the region, our partners, they have different sorts of ways of interacting with the health system. They originated in Brazil and then moved around our region, thinking of having a possibility to provide safe abortions, even in the most restrictive scenarios and in places where the health system was not providing any solution. However, through time and as legalization through our continent spreads out, it happens that acompañantes have also been able to exist and continue to exist even more in places where legalization has come through. And what is interesting about this is that I believe that it shows us that different women require different solutions when it comes to abortion. That many of them will want and really desire to have a mere plain access through the health system. And some of them would like just to self-manage, and some of them would like to have the company of other social actors. And these are conversations that are also around quality, and I would say also around safety. But on that, I believe Guttmacher guys will have, and girls will have the best answers on how to understand this security, right? So I'll just like to say that today we have a mixture of models. There are countries in which we have separate stances between acompañantes and health system. And then there are countries in which we have almost a hybrid connection in which people can be supported by both acompañantes and the health system at the same time. I believe this diversity is something we should be mindful and push through. Different women need different solutions, and we need to be able to push for the different solutions to grow.
Gracias, Diana. We're going to shift now to Africa. And Jessica, Afya Haki has pursued strategic litigation as a tool for expanding safe abortion access, where legislative change might be politically difficult. So what are the conditions under which a court victory actually translates into changes in service delivery, and where have you seen it stall? And I'll invite Jessica.
Thank you so much. Thank you so much, Destiny. I think I have highlighted how important this tool is, and I think I especially really want to thank you for making it as accessible, and usable as it ought to be. And yeah, I think just before I answer your question, I would just say that for us at Afya and Haki, we approach our litigating reproductive justice program work through the LIRA program. And it's very important that I start with that because the LIRA program anchors our work at Afya and Haki. And we would see that the anchor for the LIRA program has been the litigation agenda. And that agenda we found was very important because it helped us to ensure that our cases are grounded in the concept of Afrocentrism, which basically means providing African solutions to African problems. And the program basically aims at establishing, strengthening, and sustaining a regional network that advances reproductive justice litigation in order to ensure access to safe abortion. And we have been operating, or this program has been running for over 4 years and in 11 countries. And I think right now the program has facilitated 15 strategic impact litigation cases. And I could speak to at least 3 of them that has, sort of translated into policy or has translated into a change in the reproductive justice sphere in countries. But maybe I'll first start with Zimbabwe. In Zimbabwe, for example, through our partner, the Community Working Group, the High Court declared unconstitutional a provision from a statute that was passed by the Parliament of Rhodesia in 1977. So this was a colonial era law that was treating women with mental health challenges discriminatorily and denying them access to lawful termination. And what happened was that the court directed Parliament to amend that law within 18 months. And that case was only possible because our partners, Community Working Group, had spent years building the evidentiary record and the legal theory that made that case accessible. There's a popular case also in Uganda. Okay, maybe I should circle back first to Zimbabwe. One of the things that happened in that case was the court directed Parliament to amend the law within 18 months of that judgment. In Uganda, there's a popular petition system case, and you would find that that judgment has, and that judgment did not just stop at the court deciding the right to health argument, but it went ahead to ensure that there was implementation of that court by providing specific directions in which the government of Uganda had, to comply with. And most recently in Uganda, the Constitutional Court in successive petitions has urged Parliament, to specify the conditions under which women may access safe and legal abortion in line with the constitutional and Maputo Protocol obligations, And right now you'll find that some of our partners, one of our partners, SEHAD, Women with a Mission and Spring Public Interest, have now filed the cases on post-abortion care as protected emergency care. So I think what has made these cases work has not just been that the legal argument alone, but our litigation agenda that ensures that the cases do not just stop at what the court has said, but ensuring that there is an implementation strategy to ensure that women and girls in Africa have access to safe and legal abortion. Yeah, thank you so much. Over to you, Destiny.
Thank you, Jessica. Finally, we're going to look to Asia. So Siva, the Asian Pacific region has enormous variation in legal frameworks and political conditions for abortion access. When there is no single dominant advocacy strategy, the way that there has been in Latin America or parts of Africa, how do you build a coherent regional agenda? And what does cross-country solidarity look like in practice when the political risks are so different? Siva, welcome.
Thank you so much, Destiny. I also would like to kind of echo Diana's comments earlier on how always Guttmacher's analysis and tools have always been valuable to us. And we've often quoted the information and the data produced by Guttmacher, whether it's around adding it up, whether it's about and now this safe abortion calculator is also very valuable. So indeed, Asia is a very, very wide region with many different contexts, right? I mean, we have different cultural legacies, we have different religious groups, we have many different, ethnic identities. And so there's no some sort of homogeneous thinking that dominates the work in the region. However, we do know that a number of governments have been committed to the idea of providing public health services to their population, and aspiring for universal health coverage. And this is from the 70s onwards, right? And some of those aspirations for development, and I think that, reducing maternal mortality as an agenda, which was, I think, one of the 5 or 6 indicators around which was set even at ICPD in 1994, for, noting the progress, towards fulfilling reproductive health and rights, right? And so using the public health lens has been very critical in the region. So we've had early adopters, not necessarily for maternal mortality in China and India. It was more about being able to population control in those days. And this was the key reason for making abortion legal. And then it was closely followed with Vietnam, right? But in the later part of, in the development context, you saw Cambodia and Nepal legalizing abortion in the early 2000s, and primarily to kind of, reduce the very high maternal mortality rates. And that actually became a sort of a test case, right, for the rest of the region to say, hey, if you do legalize abortion, then what can happen is maternal mortality reduces. And that has been something that has been adopted later on, and laws were gradually liberalized in countries like even Fiji, Thailand, Malaysia, and then most recently Indonesia, although before that was very tight, and then it's still tight, but at least a little bit less tight than before. Yet we do still have some outliers like the Philippines and Lao PDR who continue to, look at abortion as an illegal procedure within their countries. As you know, one of the other interesting countries in our region is Bangladesh, which allows for menstrual regulation very widely, but every Ministry of Health person would actually stand up and say, well, we don't believe in abortion, and abortion is illegal, but menstrual regulation, it's like widely available. So on the overall, I think the public health approach, the reduction of maternal mortality, which was very much a development indicator. And for us from developing countries, we wanted to have this developed indicator programs in our countries, actually helped move the agenda. However, as you know, because of some aspects of public health services being cut down due to austerity drive, this is possibly where calculations around savings, cost savings in and using the safe abortion calculator could add a new dimension in the way that we continue to preserve access to safe abortion services, as well as guide governments towards the greater costs that are to be incurred if those safe abortion services are not provided.
Great. Thank you so much, Siva. We have one panelist left, Karoline. We're in a moment where several major donors have pulled back from sexual and reproductive health rights funding, and the remaining donors are under pressure to demonstrate impact with fewer resources. So given that reality, what does it mean for a donor like Canada to invest not just in service delivery, but in advocacy infrastructure and tools like the Safe Abortion Calculator? How do you make that case internally? And what tools do you need from those of us on the call to make that case? Welcome, Karoline.
Hi, thanks so much for having me. I'll quickly echo the thanks of others. The Guttmacher Lancet Commission forms the basis of how we approach SRHR in our work at Global Affairs Canada. So we're really grateful for all of the work that you do. To answer your question, like all of you have said, this is really a time of global change, and bilateral donors like Canada, we're facing shifts in how we approach foreign affairs and how we use increasingly limited resources. Like other donors, we're confronting difficult decisions within this really dynamic global economic and security context, and we're constantly assessing how we can continue advancing key priorities. So we remain committed to global health and to comprehensive sexual and reproductive health and rights, because we know, like all of you have said, that ensuring universal access to SRHR not only advances gender equality, but also fuels education, drives economic growth, and builds resilience for women and girls, as well as across society. So this, this rights lens, as well as the kind of economic. And we're seeing all of this being threatened, by mis and disinformation, well-resourced anti-rights actors, and advocacy grounded in data and evidence is critically important to counter this growing anti-gender movement, including against SRHR. So bilateral donors, as you know, all have different strengths and resources. Canada is often seen as a bridge builder. We're able to gain consensus. Maybe it's because of our politeness, but we understand the importance of listening to a range of perspectives, which we think is really key to building trust, keeping communication open, and countering this mis and disinformation. And this helps us in our work to connect with less aligned countries maybe, where we need to be more strategic about how we engage. So our support for SRHR, whether it's through research and data generation, evidence, or direct service provision, are all a part of this important work. And several years ago, really recognizing, that data was needed in order to clearly demonstrate the need for comprehensive SRHR in the countries where we work, we made a decision to invest really deliberately in initiatives like the work that Guttmacher is doing to not just generate data, but to provide evidence and also to support capacity building on the ground of our partners and their partners, the local networks that they work with, to have the skills and resources to be able to translate that data into policy. So we're thrilled really that some of this support has been able to be used to support the Safe Abortion Calculator, which we think is a really incredible tool for researchers, policymakers, and advocates. And we hope that you continue to see Canada as a reliable partner in advancing SRHR. And we'll continue to work really closely with you all and a range of partners to coordinate these efforts, recognizing that SRHR is essential not only to resilient health systems, but to our rights and to security and prosperity for all. Thanks.
It's a wonderful way to end this section of the program. So thank you, Karoline, and thank you to Canada for its leadership on these issues. So it's really striking, right, to hear the common threads, whether it's the formal use of human rights legal frameworks in Africa or the power of the streets in Latin America, right? The tool is often a combination of legal savvy and community mobilization, right? And so we'll hopefully hear more from our panelists at the end of our session, but we wanted to jump into Q&A given the timing and because we have a lot of robust questions in the chat. So I'm going to just dive in. So this first question is for Maggie, and it's about the tool itself. I'm getting a little bit of feedback, so we might want to put folks on mute until they speak. Thank you. So Maggie, you mentioned that the estimate for this scenario in which 100% of abortions are provided by the health system can be calculated. However, this person is wondering whether you mean 100% of safe abortions or 100% of abortions provided through the formal health system. And they go on to say, in Latin America and the Caribbean, the distinction is important because a substantial proportion of safe abortions take place without direct involvement of the health system. So I would therefore like to clarify the basis of the calculation, particularly if it is intended to be used for incidence estimates, given the relevance of self-managed abortion and the distribution of abortion medications over the counter in many settings across that region. So Maggie, we'll let you unpack that one a bit.
Thanks, Destiny. And this is a very important question. So right now, what the model can do is we cost out the cost of drugs themselves, the cost of providing training for the people who do this kind of support. So we have the ability basically to capture exactly this type of care as a safe abortion. The problem is that in many cases, and I can't speak specifically to any one individual country right now, but we do have this data documented on the website, that we often don't know what proportion of abortions fit into that category, right? Like we can't disentangle how many people are getting abortions through that channel that is very, very much safe and we would consider safe versus other kinds of abortions. And so I would be happy if anyone wants to email me directly to ask about very specific cases for a country. I can tell you what data we have. Also, as new data becomes available, we can absolutely update the model and include that. But I think right now, if we don't have that data for a specific region or country, right now you could basically consider these estimates to sort of be a high mark for costs, and know that we're missing some certain proportion of care. But this is absolutely meant to be a living tool that we are updating and making better as new information comes in. So I hope that answered your question.
Great. Thanks, Maggie. I'm actually going to stay with you for a minute. Can the calculator be used to model costs and health outcomes if the health system discontinues use of abortion methods that are not recommended by WHO? I'm thinking of countries where DNC is still commonly used.
Absolutely. Right now, DNC is not included. If abortions are provided through the health system with DNC, it is not included as a safe abortion. And so I could talk someone through in a specific country setting what that would look like in terms of using the calculator to estimate, what proportion of abortions would become safe once that practice stopped in the formal healthcare system. But absolutely, that we can use the calculator to do that.
Great, thanks. Jess, I'm going to go over to you. We have maybe one or two more questions on the tool, and then I'll ask the panelists to provide some closing remarks. But Jess, someone has said they love that there's a currency converter on the tool, which is great. How often are the exchange rates for the currency converter updated? So if, for example, I pick West African franc, is it today's exchange rate with US dollars?
Yes, so the costs in the Safe Abortion Calculator are 2026 costs in US dollars. And so the way the tool is working is interacting directly with an API that's pulling in live exchange rates. And so as you utilize the tool, it will be pulling in what the current exchange rate is. Once 2026 is over, assuming the costs are still in 2026 at that time before we, do the next update of it, it will anchor to what an average 2026 exchange rate is. But for right now, it is updating them live.
Great. And we have a lot of questions. I don't think we're going to be able to get all of them. I think our team can get creative on answering some of your questions offline or figuring out another way to get answers. Let's do one more, and I'll just open it up to whomever from our team would like to answer, and then we'll go to our panelists. So I'm interested whether any governments on our very difficult continent of Africa have shown interest in the tool yet, or are we in early days still to expect that? Anyone want to chime in on that? I can speak to it maybe a little. I think Beth would probably weigh in if she was here. I would say that it's still early days. It's only been out for a little bit more than a month, but I think we've had really good receptivity to it. We unveiled the tool at Women Deliver, and I think some of our partners there from the continent were very interested and excited about the tool. So I think part of the work ahead is working with partners on the ground to help them and support them in getting some uptake of the tool among local, regional, country level governments and other policymakers. So we look forward to that opportunity. I'm going to ask the panelists to do a lightning round, perhaps, and just so that we can end on a high note, because so much of what we do is like doom and gloom. What panelists is happening in abortion advocacy right now in your context that leaves you optimistic? So just 1 minute answers if you could. Feel free to come off video, come off mute. All of you can respond, or just some of you. What is giving you hope or is bringing you optimism right now? I see Karoline.
Oh dear, I was too quick. I sit at a global level and I don't get out into the field, as much as I would like to. But at this level, there's so many conversations happening, and those are taking place in so many different spaces and with so many different people, and sometimes that feels frustrating because there's a lot of discussions happening, and we want to move towards action, but just the fact that those conversations are happening in so many different places with so many different people, I think points to the importance of all of this work and all of your work, everybody on this call, and Guttmacher. So I'd say that's my high note. Thank you.
Thanks, Caroline. Any other panelists want to share some optimism? Siva, please.
Yeah, I think that, young women's collectives mobilizing around medication abortion has, really been very, very uplifting. And, young women's readiness to say that, their destiny is in their hands. And of course, during these tough times, I think the solidarity that we show each other, especially in the SRHR movement, because the difficulties experienced actually kind of unite global North and global South, in a way that other issues may have actually separated us. So I find both of that very uplifting.
Great, thank you. I'm sure others have optimism to share. Do it in the chat. Oh, Jessica, I see your hand. Go ahead. You're going to have the last word, and then I'm going to close this out because I know we're right on time.
Okay, I'm unable to um
Do
the
video.
video.
That's okay.
Yeah, yeah, it's okay. I think one of the things that I was probably not able to talk about is the wins that we had in 2025. And that leaves me optimistic because those wins were not just handed to us, they were built. In Nigeria, Nigerian lawyers organized and took a case to their own federal high courts. Same in Malawi, where advocates sat with a 13-year-old survivor and saw through to a structural remedy. Same in Zambia, in Zimbabwe. All of these wins were things that we built with our blood and our sweat. And for me, that is African legal infrastructure doing what it was built to do. African lawyers, African courts, African jurisprudence. It shows that we are indeed providing African solutions to African problems. Mm-hmm. And for me, the fact that anti-right actors are now organized enough, to appeal our cases, to join our cases, and to sort of push back on the wins that we've gotten, tells me that they are scared of what we're building. You can only fight this hard against something that is working. So my optimism here is that we're definitely doing something right. And let's not stop doing that. Let's not stop, not now, not ever, because women and girls in Africa and all over the world, they deserve access to safe and legal abortion. Thank you.
Beautiful. Let's not stop. Well, let me close this out on that note. I really look forward to seeing the Safe Abortion Calculator bolster the work of advocates and decision makers, those on the call who are changing women's lives around the world. I want to thank Beth, Jess, Maggie, and their teams, our amazing global communications team, for creating the tools that make the data more accessible where and when people need it. It's our hope at Guttmacher that we can continue to prove that sexual and reproductive rights matter for healthy, just societies. And by showing the math as we have today, we can move the needle toward a world in which everyone can get the safe abortion care or reproductive health care they want. Thank you all for joining us. Let's not stop. Enjoy your day, enjoy your evening, get some sleep, or have a great lunch. Thank you everyone for joining us.